glad you could make it this afternoon to our City of Little Rock 2018 Retirement Education Meeting. We thought it was important to spend some time to talk about retirement, just so everyone could get some information. We do have a representative here from Social Security as well as Medicare, and we're going to talk about the city's plans and how they're working with your medical, the clearance process when you get ready to retire, as well as the pension plan, okay? So we're just going to get started. And also, if you do have a question, you can ask questions throughout, but you have to use the microphone. So we do have a microphone over there, and if you raise your hand, we'll give you the microphone before you can ask the question, okay? All right. My name is Robin White. We have Latoya Covington here. She's going to talk about the clearance process. We also have Regina Hopkins. She's going to talk about the pension plans. We have Phyllis Deals here from Social Security. Raise your hand, Phyllis. Okay, she's going to talk about Social Security. We also had David Casanelli here to talk about Medicare. Okay, we had a big group the past session, a lot of good information. So we hope that you guys get something out of this, because we did, like, again, put this together so you guys could get the information that you need, because some of you are pretty close or getting close to retirement. Okay. All right, just a couple of things I wanted to cover so everyone could these are some changes that have happened recently, and things that you need to know. If you have not did your annual physical, we know the June 30th deadline has passed, but if you have not did your annual physical, you still need to get that done so you can stop that $25 charge per paycheck. So if you haven't had your physical, make sure you get that done, okay? And this is going to be a recurring thing. So every year we're going to do this annual physical. So just kind of get used to that process of having your annual physical, and also supplying us with the information to support that you've had that physical, okay? All right, benefit end dates. This is something new for this year. For 2018, we implemented the process of, if you terminate or retire on or before the 15th of the month, your insurance will end on the 15th of the month, okay? If you terminate or retire after the 15th, so the 16th to the end of the month, then your insurance will end at the end of the month. So that is something new. Okay, so I need everyone to be aware of that, because we get this question a lot, because someone retires, let's say on the 10th of the month, and they think their insurance is going to last until the end of the month. It ends on the 15th. If you terminate or retire between the 1st and the 15th of the month. Okay. Also, if you have an FSA account, if you have a flexible spending account, that flexible spending account, you would no longer have access to it upon your retirement date, which means that on the date that you retire, access to the FSA account will end unless you continue it through COBRA. You can continue it, but you have to pick up COBRA in order to do that. So what I'm saying is, if you have an FSA and you have put money into this account to pay for doctor's visits, prescriptions, glasses, things like this, you will need to make sure you spend the money before the retirement date. If you do not, you will not have access to it unless you go into COBRA. Okay? And your dental and vision coverage will continue till the end of the month. So the only one that ends at the 15th, if you terminate before the 15th, is the medical. The vision and the dental will continue. Okay? All right, which benefits can I continue? We're talking about when you get ready to retire, which ones you can continue. Continue the medical, the dental, and the vision. The voluntary benefits, which are through Trustmark, you do have to contact Trustmark. They will send you a packet to say, hey, we've been notified that you have left the city of Little Rock. What do you want to do? At that point, that's for those that accidental care benefit, the cancer policy, and the whole life policy. So for those three benefits, if you want to continue those past retirement, then you have to contact Trustmark directly. Same thing with MetLife for your life insurance. If you want to continue your life insurance, you have to contact MetLife, and they will they will automatically send you a packet, but you will have to comply with the packet, respond back to them, and let them know you want to continue the life insurance. Okay? All right, how long can I continue my benefits? You can continue if you retire until age 65. So if you retire prior to age 65 or until you're Medicare eligible. So prior to that, if you retire 62 or 55 or 58, anything prior to 65, you can stay on the benefits until age 65. If you retire after 65, then you're Medicare eligible and you will automatically go into Medicare. Your dependents, if you have a spouse that's younger than you, the spouse can stay on the plan, as well as the children. The spouse can stay on until they become Medicare eligible, and the children can stay on until they age out, which is currently 26. Okay? Any questions on that? All right. Okay, just a reminder, you need to make sure we have your current address. So if you're getting ready to retire and getting all your paperwork together and everything like that, make sure you provide us with your current address, because we send a lot of information out to retirees, as well as when you go through the retirement process, information is going to be going out to you from the COBRA administrator, from our retiree benefits administrator. So everything is done through the mail. Make sure we have your current address. Also, beneficiaries, make sure you update your beneficiary information. That way, if something happens to you, we know who to contact. Then also they know, that they can contact us, so we can provide them with the information they need. But you have to make sure it's current. So, get divorced, or maybe if you had someone on your plan as a beneficiary that has passed away, you need to make sure you update that, because sometimes people just leave it for years and years and years and don't think about it, and then something happens and we're searching for a beneficiary. Okay? All right, any questions so far? All right, at this time, I'm going to turn it over to LaToya, and she's going to go over the termination clearance process. So thank you all for coming, and I'm going to give you to LaToya.
Hello, I'm going to present to you the City of Little Rock Termination Clearance Overview, which will go over when to contact benefits, the termination clearance process, continuation of benefits, and retiree benefits qualifications. Although we do have a mixed crowd in here today, this may not apply to you, the process. However, I would suggest to follow your process of termination with your area or agency. So here's the termination clearance form. When you come in, we prefer that you already have it in hand, you get it from your department, and follow the steps on there. The termination clearance part of it, some people skip that or may not want to do that, because at retirement you're ready to leave and just, ready for retirement. However, some people need to know as soon as possible what to expect once they retire, and again, we'll go over that process. It's best to contact benefits department within 30 days of retiring so that we can get your information together. We'll go over the benefits, we'll get the pension information together, everything that's available to you once you retire. Because the termination clearance process, the major importance of it is because of your leave. This ensures your leave payoff, as well as knowing what benefits you do have to continue. In the process, this is the continuation of benefits form, which is just a form that we'll go over. We'll go over your actual retirement date. If you're retiring June 1 or expected to receive retirement June 1, we need an actual last day of work. So that's why this is important, because we look at that regarding your health insurance term date as well as other benefits termination dates. Consolidated Administrative Service will actually send you a packet in the mail, but again, this is just to be informed of what you're expecting to pay once you retire. You do have this document in your packet or your folder, and you'll see different rates as far as COBRA rates and retiree rates. Those different rates are based on a number of reasons. If you're at retirement or meet the rule of 70, you'll pay for 6 months the COBRA rates, the first line. And then after the 6 months, Consolidated Administrative Service will send you a new packet with the new rates, and you'll see the retiree, or you'll start paying those retiree rates. Also, with this, again, let me go to the next one. So with the next slide, how do I continue my benefits? Information will be provided to you in the termination clearance process. So of course you've called 30 days in advance, but we'll actually want you to come into the office and meet with us, and we'll give everything to you as far as leave payout, your final pay, when your final pay is, who you should contact as far as Arkansas Diamond, or if you have lot fee, nationwide, things like that, and possible rollovers. You will receive a packet of information from our COBRA administrator and retiree administrator, which is currently Consolidated Administrative Services, or we may say CAS, you will make payments directly to the COBRA administrator and not to us. So make sure again that the address that you provide us is correct, so you will receive that packet on time and when you need it. Any questions about the process of termination? Yes.
Basically, I want to make sure I'm clear on this. When you get ready to retire, we come and let you all know, and we fill out the form for the insurance. Is that correct?
We'll provide you the information that gives you the rates for the benefits. It's not enrolling you in the benefits, it's just to give you that information. And then within so many days or in the near future, Consolidated Administrative Service will send you a packet, and that's when you'll elect the coverage you want to continue.
Okay, thank you.
You're welcome. Any other questions? All right. Oh, sorry.
So does that process have to be done before the 15th or before the end of the month after retirement, or will?
It's done before retirement, and you want to do it at least 30 days before you're expecting to retire, so that you can have everything in order as far as your benefits in order, as when to expect to have it start. Even with pension, you'll know when you're going to expect to receive your pension, so everything is before your expected retirement date.
So in other words, that's why we're doing this in advance, so that they will provide that information to us and give us the option of the continuation of the insurance prior to it running out.
Well, they'll send you the packet after we term you in the system, but we do this in advance again, so you'll know what to expect to receive once they send it to you. Okay, with the COBRA coverage, you have 60 days to enroll in or to elect the coverage you want to continue. So once they fill it out, once you receive it, you'll complete the form, send it back, but again, you have 60 days to enroll.
What would happen? You'd be in a pending status, okay?
Okay,
I saw
okay.
your mind working there. Yeah, you'd be in a pending status. So what would happen is if you do have a claim, as long as you elect COBRA, they will go back and cover that claim for you. So you won't have, because COBRA is a continuation, it cannot end.
It won't be a break in
There has to
coverage.
be no gap, okay?
So what if you decide not to go in? So if you decide not to go into COBRA, then you go into the marketplace?
You can.
But the only thing with that is if you decide not to do COBRA, then you can't take the retiree benefits. You have to do the COBRA to get into the retiree benefits, okay? And if you look at the rates, you see the retiree rate is, really a good rate. So, but in order to get that rate, you have to do COBRA to get there.
For that 6 months, yeah.
Yes.
Yes,
COBRA.
6 months.
Any other questions?
All right. No further questions. I'll turn it over to Regina Hopkins. She'll go over the pension.
Hello. All right, so first thing I will mention is something most people are familiar with, but just as a reminder, your contributions that you are making into the city pension plan is 4.5% of your base earnings, and the city is putting in 9% of your earnings. We'll quickly go over vesting. Once you've been here for longer than 5 years, then you're vested into the pension plan. So once you're vested, that means the money that you put in the plan as well as the money that the city puts in the plan is available for you at retirement age. If you decide to terminate your employment before you are 100% vested, then the money that you will receive are the contributions that you have made and not contributions that the city have made. So just your contributions plus any interest is what you'll receive in a lump sum if you leave prior to 5 years of service. But yes.
I know that we started a new plan. What year did it start and when will it be vested?
If you were already employed here, your years of service count you as vested into that plan. Okay? Does that answer that? Okay. I think that question came up last last session too. All right, I'll move on to the retirement plans. The first retirement plan, this is a statement from the DC plan, the defined contribution plan, which most people consider the old plan. We have some people that are still enrolled in this plan, and then we have some people that chose to use this plan to purchase time into the new plan. So the DB plan payout is a lump sum. So if you still have this plan, you end your employment with the city through termination or retirement, you will receive a lump sum of the DC funds 6 to 8 weeks after the quarter ends. Okay? And this is how the DC plan works. We'll move on to the DB plan. A little bit more information on the statements there. So the DB plan is set up to pay you as long as you're living. So this is going to pay you a monthly amount. And so it does have some calculations there based on your retirement date. It gives you an estimated retire date of when you'll be 65 and shows you what you can expect to receive at 65. It also gives you options for 62 with 10 years of service and 55 with 20 years of service. The statement also, you make sure it has your hire date on there, shows you years you've been in the actual plan. All of our years probably say 4 right about now. If you've been here for a while, it will show you any service that you purchased from the DC plan, and then it will total it up showing your total credited service that you have with the city. Yes, ma'am.
Does this amount that's on here, for instance, you retired when you were 62, does that amount have anything affect on your Social Security? Also, if you chose to retire early, would that have an effect on it?
Okay, we do have someone here from Social Security, but she's shaking her head no. But she will go into to detail when she comes up.
Thank you.
Any other questions on this pension statement? Because I can go into a lot more detail, but I just don't want to make sure I don't take up too much time and leave time for questions. Now this is an election form. So this is another reason why we do ask employees to come in advance when you're ready to retire. So we work with the actuaries to prepare this form. What we do is we pull your 60 months of salary history, and the actuaries use the highest 36 consecutive months of your income, of your salary, to determine your average compensation. My apologies. I think the camera got me nervous. Yes, ma'am.
Can we go back to the DP plan? I have a question on that.
The DB?
No, yeah, that one.
Yes, ma'am.
So say, for example, we decide to retire at age 55 with 20 years of service, and we get that dollar amount. If we make it to age 62, do we go up to that dollar amount, or are we stuck with the age 55 20-year amount?
Okay. I'm not sure I understand your questions.
So, I guess say for example, it says 5/30/84. We decide to retire at 55 with 20 years, and we're now receiving 5/30/84. Do we receive that 5/30/84 until we get to the age of 62?
No,
And
ma'am.
then be bumped up to 67?
No.
Okay.
No. If you choose to elect your coverage at 55 and take that 55 rate, that's the rate that you have.
And
Yes.
it will not change?
And it will not change. So you definitely want to consider, there's a big difference between the 55 with 20 years of service and the 62 with 10 years of service. But I know I've seen, I mean, a lot of people do think 62 is not a big, not as big as difference as 65. So, any other questions on the DB statement? Okay, just want to talk about the election options. Once again, like Latoya said, we will ask everyone to come in advance when you're ready to retire. That way we work with the actuaries to generate this form here. This form here will show you the options that you can elect for your retirement. So this is where you choose how much money you'll be expecting to receive each month. So as you'll see, you'll have an option for normal form. Normal form is life annuity, which means as long as you're living, you will receive that amount. The next one is life annuity with 10-year certain payments. You will receive up to, you're guaranteed 120 payments. So if something happens to you before all 120 payments are issued, then your beneficiary will receive whatever payments are left out of the 120 payments. But I mean, that normal form above does not have a beneficiary tied to it. So you just receive your pension as long as you live. Once you pass, nothing happens with that pension. That's the end of it. Typically, the first two options are not elected by spouses, but what we have is a spousal form that is attached to this form that if you choose the option 1 or 2, you have to have your spouse sign away their rights to your pension. So for the most part, most married couples look to the options below, which are joint benefits, joint and survivor. So there are options for joint and 100% survivor, joint 75% survivor, and 50% survivor. That basically means that you'll elect the coverage that you'll be receiving every month, and then your spouse will, once something happens to you, your spouse will then either receive that 100%, 75%, or 50% after you passed, as long as they live. So you have those options, and once you do select those options, those are the options that you have to stick with as long as you're in that pension plan. Are there any questions? No problem.
Okay, if I pass away before I retire, is that pension plan that I already signed up for, my beneficiaries go ahead, do they get the lump sum, or are they gonna get payments? How does that work?
So you're referring to if you are still working here?
If I'm still working here,
Okay.
if I pass away before I could retire, what about my money that I have already put in my pension and the city has matched? Will my family get it right away, or will they get it in a pension?
They will get it right away in some situations. I think the employee has to be at least 55, so, or have been 55. So if the employee had not reached 55 and they pass, then the beneficiaries have to wait until the employee reaches 55 to start drawing it. But if you're over 55, then your beneficiaries will be able to draw your pension funds.
So they are drawing the funds, they're not getting the lump sum?
No.
Okay.
How long do they? How long will they receive the funds?
For as long as they're alive. Any other questions? Okay, well, I'm surprised, but if there are no other questions, well, one thing I do want to say is make sure that anytime you have any questions about your pension statements or retirement, you just give us a call. We prefer you set up a meeting only because that gives us the opportunity to pull all your files and everything and have everything ready to answer questions for you. But you can always reach out to us with any questions on retirement or statements or anything like that. Okay? I'm going to turn you over to Phyllis, Social Security office.
Thank you, Regina. Hi, everyone. Good afternoon. My name is Phyllis Dills, and I'm a public affairs specialist for the Social Security Administration. And part of my job is to go out into the community and educate the public about our programs and services that we have. And so that's why I'm here today. I think Regina's getting my PowerPoint pulled up here. So today, we are mainly going to be talking about the retirement insurance program. We're going to discuss that as well as what happens to your benefits if you work while you're receiving those benefits. And we're going to discuss taxation of benefits. And I'm just going to briefly talk about the Medicare enrollment period since Mr. Casanelli is here and he's going to be talking to you all about Medicare. So let's go ahead and get started. Our retirement insurance program was created back in 1935, and just as it was then, it is now. There for you to build upon with other forms of income in retirement years, okay? So it was never intended to be your sole form of income in retirement. And luckily for you, as city employees, you have a pension plan, so that will help aid that. But any other savings and investments can help put into your retirement income as well. With Social Security retirement, it is an insurance program, and you have to work and pay in those Social Security taxes in order to be insured to receive a benefit from us. So you do that by working and paying that Social Security tax, and you earn those credits. Over your lifetime, you need 40 credits in order to be insured for a retirement benefit. Now, you can earn up to 4 of those credits in a year, so in as little as 10 years of work, you can actually be insured for a retirement benefit. It may not be a very high benefit, and we'll talk about that a little bit more in a minute, but you can be insured in those 10 years. For 2018, each $1,320 earns you 1 credit in the program, okay? So in 2018, once you've earned $5,280, you don't have to wait till certain quarters of the month or the year. Once you've made that earnings, you've got your 4 credits for the year. Now this chart gives you an idea of what you can expect to get back in your pre-retirement earnings from Social Security once you retire. A low wage earner is going to expect to get back about 55% of their pre-retirement earnings, an average earner about 41%, and a high earner about 34%. So just to give you a little bit of idea of what these percentages represent, someone earning or getting back about 41% earns about $65,000 a year. Okay, so that kind of gives you a basis to understand those percentages. So with Social Security, you have some options as far as when you retire. You can do what we call an early retirement, and an early retirement is any age from 62 until your full retirement age, okay? When you take an early retirement, you will have a reduction in your benefit, and that reduction is based off the number of months you are away from your full retirement age when you start drawing. Once you turn your full retirement age, you can draw your full benefit. Of course, there's no reduction there. And then your third option is to delay retirement beyond your full retirement age and earn what we call delayed retirement credits. The delayed retirement credits can increase your benefit up until age 70. Once you turn 70, though, it won't grow anymore after that, okay? So what is your full retirement age? A lot of people misunderstand what full retirement age is, and it's actually based off the year you were born, okay? So back when Social Security was enacted, everyone had a full retirement age of 65, but in the early 80s, they made some amendments to the Social Security Act, and they wanted to increase the full retirement age to 67. In order to do that, though, they wanted to gradually implement that so that it's not just all of a sudden taking effect and affecting everyone. So they did that by the year you were born, so that's why someone born in 1957, their full retirement age is 66 and 6 months. Sir, did you have a question? Oh, hold on just a moment.
I'm trying to get some clarity on that. When you say, if I retire at 63,
Mm-hmm.
the benefits that I get then, they will not change at 65? Is that
Correct. Once you start drawing your Social Security, you set your rate. So if you take a reduced benefit, you'll receive that reduced benefit over your lifetime. It won't increase once you get to full retirement age. Now, we do have cost of living adjustments that may increase your benefit. And if you're someone who maybe continues to work, that could possibly change your benefit amount as well.
okay, thank you.
Mm-hmm. Yes, sir. Did you have a question? I just answered it for you? Okay, great. All right, so let's talk now about the differences in what you can receive based on your age, okay? This is what this chart kind of represents. If your full retirement age is 66, and you can get $1,000 at 66, but you take it at 62, you're gonna have a 25% reduction in your benefit, okay? And then on the opposite end of that spectrum, if you wait and do the delayed retirement credits, you're gonna increase your benefit at 8% per year, so you'll add another 32% to your full benefit if you wait until 70. Okay. Yes, sir.
I'll be 66 in September,
Mm-hmm.
and I would like to start drawing that. Am I going to be penalized because I'm still working full-time with the city?
It's 66, you've reached full retirement age. Once you reach full retirement age, there isn't a penalty based on your work. But we will talk more about the work and the restrictions you have on work under full retirement age in just a minute.
Thank you.
Uh-huh. Okay, so the question we get asked a lot is, when is the best time to retire? What is the best age for me to go and file for my Social Security so I can get the most out of it? Well, we can't really answer that for you. The reason is that we don't know when you're going to pass away, okay? If we knew when you're going to pass away, I could say, this day you need to go in and you need to file, and you're going to get the most you can get from Social Security. But we don't know that. And so what we'd like to do is encourage you to think about your own personal circumstances and situation. We want you to think about what kind of income needs you're going to have in retirement and what other forms of income you're going to have with Social Security. Think about your health and those healthcare costs and things like that. Also, think about your family longevity, okay? How long do the men in your family tend to live, and how long do the women in your family tend to live? And that will give you kind of an idea of how long you may need income in your retirement years. So it's something really important to look at. This slide goes over just average life expectancy. For a man reaching 65 today, they can expect to live on average until 84.3, okay? So just over 84 years. That's average life expectancy. A woman turning 65 today, that's 86 and a half, okay? So that's something to kind of compare and look at, but I really recommend looking at your family tree. If you have somebody that's living well beyond these ages that is closely related to you, then you may live that long. For example, both of my grandmothers lived into their 90s, so I expect to live into my 90s, okay? Okay, so how many of you remember getting that paper Social Security statement in the mail that had your benefit estimates on it? Probably hadn't seen one in a while. We had to stop sending those out because of budget cuts, okay? But we do have an alternate way to get that, which is online through our My Social Security account. And we're going to talk about that in just a minute. But what I want to ask you is, did you ever look at your benefit estimates and wonder how we came up with that? Well, I'm going to show you how we do that. So first of all, we take your wages over your lifetime and we adjust them for changes in wage levels. What does that mean? That means the dollar that you're making today has a different value than the dollar you made 20 and 30 years ago, okay? And so we take all of your earnings and put them on a level playing field with today's dollars. And then we find your monthly average of your highest 35 years of earnings, okay? You remember earlier, I said you could insure yourself in just 10 years of work, but your benefit wouldn't be very high. Well, this is why. If you'd only worked 10 years, we would average in 25 years of zero earnings to come up with your benefit amount, okay? But we look at your highest 35 years. So once we get that result, we plug that into a formula, and I have an example for you. If your average monthly benefit is $5,500, or your average earnings over those 35 years is $5,500, then what we do first is we take 90% of the first $895 and we set that over to the side, and that's where you see the $805.50 right there on the right, okay? Next, if you have earnings over $895 through $5,397, then we take 32% of those earnings and we set that over to the side. That's where you see there the $1,440.64, okay? And then finally, if your earnings are over $5,397, in our example, we're over that, we take 15% of that and set it over to the side. And that's where you see the $15.45. So all of those on the right-hand side there, we add that all up and round it down to the whole dollar to determine your benefit amount. And one of the things I want to point out to you is that the bend points here, the $895 and the $5,397, those are called bend points. Those can change from year to year, and if you're ever having trouble sleeping at night, you can go to our website and read all about them. But those are actually tied to the average wage index, and that's why they can change from year to year. So we tie those to the average wage index because if we have an average wage index that's high, that has a positive effect on how much your benefit's going to be, okay? Because that means we have more people that are working and paying into Social Security. Therefore, we have more revenue coming in to fund our retirees. And that's why you can see that change from year to year. Another thing to point out just quickly about the last slide and how we determine your benefit, that formula applies just in the year that you retire, okay? Next year, if you retired this year and next year that formula changes, we're not going to recalculate based off of that. It's only affecting you in the year that you choose to retire. Okay, so let's talk now about our My Social Security account. This is your own personal online account where you can review all of your estimate of benefits and your earnings history. Does anyone in here already have an account established? Great. Okay, well, if you don't, I highly encourage you to do that. In order to set up an account, you only have to be 18, have a Social Security number, a U.S. mailing address, and an email address, okay? And you can get your account set up and view all of your estimates and your earnings information. So if you're not receiving benefits through the when you set up your My Social Security account, this goes over the functions available for you. Our most recent addition to the My Social Security account is the ability to request a replacement Social Security card. Anybody in here need a replacement card? Don't want to go down to the office and wait in line and take off work to do it? Yeah, it's not very convenient, is it? Well, now, if you're not making any changes, you don't need to change your name or anything on your card. You just need a replacement. You can go through your online account, make that request, and it will come to you in the mail in about 2 weeks. So it beats having to take time off of work and sit and wait in the Social Security office. You can also check the status of an application or an appeal. You can ask for a benefit verification request to show that you're not receiving benefits. You can also get the information off of your Social Security statement, so you can review your earnings history and all of your benefit estimates. And if you really liked that piece of paper that we sent you in the mail, you can even print it, and it'll look just like what you'd normally get in the mail. And then you're also going to be able to view things like your estimated Social Security Medicare taxes that you've paid over the years. Now, if you're receiving benefits, so if you sign up now and then you go ahead and file for your benefits later, your account changes and it opens up more functionalities for you. So you can do things like change your address, your phone number, your bank information. So if you need to change banks or something like that, you can just go online and put that information in and it'll be up to date. It will also give you the ability to print that benefit verification to show how much Social Security income you're receiving. So when you go to the bank to get a loan for that yacht that you're going to buy and sail around the world, you can print your benefit verification right off of the computer. So you won't have to go to an office and wait for it or wait for one to be mailed to you. Also, you can get a replacement 1099 form. We're going to talk about taxes and your benefits in just a minute. But the 1099 form we mail out to you every January, and if for some reason it gets misplaced, you'll be able to log into your account and print another one for you to use for tax purposes. All right, so besides the worker themselves being eligible for a retirement benefit, you may have a spouse that can receive benefits from you as well, okay? So they have to at least be 62, and you have to be the worker has to be receiving benefits as well. The most the spouse can receive is half of the worker's full benefit, but in order to get the full half, the spouse has to wait until their full retirement age, okay? If they draw that spousal benefit before their full retirement age, then it is reduced. And that reduction is even more than what we saw earlier by the worker taking their benefit early, okay? Another thing to mention is that a spouse, if they're insured on their own work record, then they can't draw off of both at the same time, okay? They're going to have to take the higher one. And then if a divorced spouse is in the picture, I don't think we've got this on here, but a divorced spouse can receive benefits as well. Here's my divorced spouse. So the divorced spouse, in order to receive benefits, the marriage had to last at least 10 years. Both you and the divorced spouse must be at least 62, and the divorced spouse can draw benefits even if you're not drawing off of your record yet, okay? One of the things to point out here is that, just like the spouse, they can't draw the divorced spouse benefit in their own, so they're not at any more advantage than your own spouse. And then if you are remarried, your current spouse and ex-spouse benefits won't affect one another. They're not offset for each other, okay? They're, like I said earlier in the earlier session, unless that divorced spouse calls you and tells you that they're filing and drawing that, you probably won't even know that they are. Okay, so to apply for benefits, we have some different options. I highly recommend going to our website at socialsecurity.gov. It takes on average 15 minutes for someone to complete their retirement application. Does anyone in here think they can get to an office and park and go inside in 15 minutes? No. Okay, and that doesn't even count, your wait time and being there at the office. So we're trying to make these services available to you just for your convenience, okay? Now, if you're not comfortable with a computer, that's fine. You can have a family member help you if you'd like, or if you really want to set up an appointment, you can do that by calling us. This is our National 800 number up here. It's available 7 a.m., 7 p.m., Monday through Friday, and you can call them and schedule an appointment. You can have your appointment done by phone or in the office, so it's up to you on how you want to do that. And so that would be another option. Your third option would be to go to an office and file for those benefits without an appointment. I really don't recommend this option, and that's just simply because you never know what's going on at the Social Security office. How many of you have been to an office recently? Was there a few people there when you went? Yeah. Sometimes we have a lot of people that come to see us.
Worse than the revenue office.
Yeah. We have a few people come to see us every day, and sometimes even here, I work out of the federal building just down the street, and there are times when we have to close the door to our lobby and not let anyone else in because it's a fire hazard to have anyone else in the lobby, okay? And so if you showed up on a day like that to file your application, we're probably just going to set an appointment for you, and you'd probably be pretty upset to have waited 30 minutes to an hour for us to set up an appointment, okay? So I really would recommend that you schedule an appointment if you're not comfortable doing the online application. This is our website at socialsecurity.gov. This is a screenshot of our homepage. And you can see here there's some different tiles on the front. There's a retirement one. If you click there, it'll take you to the retirement application. Or there's a menu button at the top, and when you click that, it's going to drop down a menu. And there's a section called Benefits, and it has various links to our different benefits, such as retirement, disability, survivor's benefits, Medicare. So you're going to click what you want to file for, okay? You'll be able to file for disability, retirement, and Medicare all on our website, okay? The survivor's benefit, you do still have to do that with an office. We don't have that available online. All right, so now let's talk more about working while receiving benefits. I know we mentioned this a little bit earlier. With Social Security, when you're under your full retirement age, if you want to draw your benefits and work, you can. However, there are certain restrictions that apply. And so this is what this chart goes over for you. In 2018, if you're under full retirement age, drawing your Social Security and working, you're held to a limit of $17,040 for the year before you'd see any kind of reduction in your Social Security based on your work. But if you work and you earn over that amount, then your benefit from Social Security is reduced $1 for every 2 that you go over. Okay? So if you went over, let's say, by $5,000, then we're going to reduce your Social Security benefits by $2,500 and then pay you the remainder. Okay? Now, the year your full retirement age is reached, that amount increases. You can actually earn up to $45,360, and the reduction's a little less steep. It's $1 for every 3 that you go over. Okay? And then in the month of your full retirement age and beyond, there's no limit on your Social Security or on what you earn. So you can earn and make as much as you want and draw your full Social Security as well. Okay? So one of the things that's kind of interesting about this, I want to point out to you, is that if you work and draw your Social Security and we withhold some of your Social Security because of your earnings, you kind of recoup that back once you get to full retirement age. And let me explain to you how that works. Let's say you took your Social Security at 62, and between 62 and your full retirement age, you had 24 months of your Social Security benefits withheld because of your earnings. So once you got to full retirement age, what we would do is go back and recalculate your benefit as if you filed at 64 instead of 62. So you get those 24 months back in the calculation of your benefit. What we consider income as far as this policy on your working and drawing Social Security is only your gross wages from employment or net earnings from self-employment. There's a couple of areas that kind of trip people up sometimes, such as your sick or vacation days that might be paid to you from your employer. Those are considered earnings. Also, if you receive a severance pay, that's considered earnings. However, any inheritance payments, pension payments, VA benefits, interest, dividends, capital gains, those are not considered at all in these restrictions on your earnings, okay?
So it won't.
Hold on just a moment. There you go.
So I'm drawing a pension. I was a Little Rock firefighter, retired after 28 years. I'm not going to be penalized by Social Security because I'm drawing a monthly pension from them.
Did you pay into Social Security while you were a firefighter?
Only on off-day jobs.
Okay, well that's a little different. That actually,
I have all my credits.
you have all of your credits, so do you have your substantial earnings then? Okay. It can still be offset depending on how much credits that you have. And I actually have a fact sheet over here I'd like to give you afterwards so you can look at it and see for yourself. But what you're talking about is called a windfall elimination provision. And that applies to individuals who've worked a large portion of their earnings come from a job where they didn't pay into Social Security and they had a private pension.
Okay, another thing, I plan on drawing Social Security this year, and I also plan on continuing to work for the city.
Mm-hmm.
Will the, I'm trying to figure out, will I still pay that Social Security tax? Okay.
Yes, your earnings will still be taxed by Social Security. And one thing to point out there is if you start working, you're continuing to work, you may be earning high enough that it replaces one of your 35 years that we used in your estimate or your calculation. And so your earnings that you continue to make could actually increase your Social Security. Okay?
Thank you.
All right, so now let's talk about taxation of benefits. This is something that I usually put in my presentations because this is something I would want to know if I were you. And two, I know there's a lot of people who don't know this because we get a lot of people upset and angry around tax time that call us because they didn't know their benefits could be taxed. So I'm telling you this so you can't be angry with us, okay? So under Social Security, if you receive benefits and your combined income falls into one of these categories up here, okay, whether you file individual or joint return, there's two different categories in which your combined income might fall, and if it does, then your benefits are taxable, okay? So if you fall in the lower category, then half of your Social Security benefits are taxable. If you fall into the higher one, then 85% of your benefits are taxable, okay? So what we look at is combined income, and your combined income is your adjusted gross income plus non-taxable interest plus 1/2 of your annual Social Security benefits. When you add those up, if it falls into one of those categories, okay, you're going to have to pay some taxes on your benefits. We have about 1/3 of the people receiving benefits actually do have to pay taxes on them, and that's why we send out that 1099 form to you every year in January so you can do your taxes with that, okay? One other thing to point out, if you're like me and it comes to tax time, you don't like owing Uncle Sam some money, you can actually file a W-4 form with your local office and we will do a withholding for you, okay? So the only thing I would recommend is that you talk to a tax preparer before you come in to determine what kind of percentage you need withheld from your benefit. All right, so let's talk now just a little bit about Medicare. I'm going to just delve into these enrollment periods here. They're really important. I'm going to let Mr. Casanelli talk to you all about the other parts of Medicare and more information that he has. So we have 3 different enrollment periods. First is your initial enrollment period, and that's around your 65th birthday, okay? Most people become eligible for Medicare at 65. There are other ways that you can become eligible, such as receiving disability or having ALS or kidney failure, okay? But most people are 65 is the age of Medicare, okay? So that's what we're going to focus on here. So before you turn 65, you can enroll 3 months prior to the month of your 65th birthday. That starts your initial enrollment period, includes the month of the birthday and the 3 months after that. So you have 7 months total to get enrolled, okay? So what we recommend that you do is probably about 4 or 5 months before your birthday to just kind of make an assessment to see if you need to go ahead and pick up Medicare in your initial enrollment period. So that assessment, you need to look and see, am I going to continue to work past 65? And do I have group health insurance through my employer? Or is my spouse working and has group health insurance through their employer that covers me? And if that's the case, then you can forego this initial enrollment period, save yourself some premiums, and take advantage of enrolling during a special enrollment period, okay? Your special enrollment period begins the month in which the insurance ends or the work ends, whichever comes first, okay? It includes that month and the following 8 months, so you have 9 months there to get enrolled in the special enrollment period. We recommend that you go ahead and talk to us in the month that change is happening, okay? That just gets everything set up and taken care of a lot faster. Now, the third enrollment period is your general enrollment period. It runs January through March each year. And if you enroll in the general enrollment period, your coverage isn't effective until July. But that's not the bad thing about the general enrollment period. The bad thing is that if you fall in the general enrollment period, that means you either missed your initial and didn't qualify for the special, or maybe you qualified for the special and you missed it somehow, okay? So that makes you fall into the general enrollment period, and that means that you could have to pay a penalty because you didn't get enrolled in Medicare when you should have. So that penalty is actually 10% per 12-month period that you failed to enroll. So if you had 2 years go by, that's a 20% penalty on your premium for Part B, okay? And that is a permanent penalty. So you're going to incur that every month that you have a premium to pay for Medicare. And the Part D program, which Mr. Casanelli is going to talk about more, it has a penalty as well. It's 1% per month that you failed to enroll, okay? So it's really important that you get enrolled into these plans when you should. And if you have questions about that, I'll be glad to talk to you maybe one-on-one, or if anyone has any questions now, I'll be glad to talk to you about it. Okay, well, I want to touch here just quickly. This is the Medicare.gov website. They have great information there as well, but one of the things I want to point out is that with Social Security, we handle your enrollment in Part A and B. We also handle having your premiums taken out of your check as well, okay? And we can put in a request for you for a replacement Medicare card. But any other services or information that you need from Medicare, you need to go directly to Medicare. They handle the administration of the benefits, and we're not even educated on that because we don't handle that portion of it. Okay. Do y'all have any questions before I hand it over to Mr. Casanelli? All right, well, I'll go ahead and hand it over to him, and I'll be here afterwards if you'll have questions that you don't want to ask in front of the group.
Okay. First of all, good afternoon. Thanks for taking the time to be here today. My name's David Casanelli. Our agency is Medisource. We're Medicare insurance advisors located here in Little Rock. We work with individuals like yourselves as they're help them transition off the group to do that assessment that Phyllis had mentioned earlier a few months before you reach your retirement. And so today what we want to cover is just a little more specific about what Medicare covers, the different parts of Medicare, and then how to add on to that coverage with supplemental coverage, drug coverage, and other types of coverages that are available to you. Just to follow up with Phyllis, I mean, she did a great job with the enrollment periods for Medicare. Just want to, just on the front end, say, you know, if you're going to stay on the group, you're fine. You have what's called credible group coverage. So you don't need to do anything as far as Medicare is involved if you're going to work past 65 and stay on the group. That special enrollment period will be available to you when you come off the group, and it's just like you're turning 65, okay? So that's something everyone gets a little confused on, and so now if you are retiring at 65, it's paramount that you do take advantage of your enrollment, initial enrollment period. And also on the insurance that I'm talking about, that's also your guaranteed issue period. So that's where we have no health questions. We can get anything we want that is available to you. And it's very important that during that initial assessment that you understand that, because it's really the only time for the rest of your life you're going to have every option available to you in a guaranteed issue from the carriers. So a lot of the mistakes that are made are when people miss that guaranteed issue window. So, but we'll get a little more into the details, and I'm sure some of you will have some questions around that. The first thing we're going to talk about is Medicare. So you're all, I'm sure, as you're approaching 65, are getting lots of mail from the carriers and stuff, and a lot of scare tactics that you have to do this and that. And so that's what we're trying to make sense of. So the first thing I like folks to distinguish is Medicare are the parts, okay? Part A, Part B, Part C, Part D, okay? Original Medicare is Part A and Part B, okay? And we'll get into what those are specifically and what the benefits are. The Medicare supplements, or the Medicare health plans that you get a lot of mail about, those are the plans, okay? And it's just real important. That kind of keeps everything a little clearer for everybody of what we're talking about. The plans are Plan F, Plan G, etc. So a lot of times people get F and A and B and D and everything mixed up. And so just understand that the private insurance is going to be the plans. The government insurance, Medicare, is going to be the parts. Okay. So what are those parts? Original Medicare consists of Part A, which is your hospitalization coverage. It is free to most. It picks up 80% of your charges at the hospital, and it includes a $1,340 deductible per occurrence. So that's per year, every occurrence. So if you went in the hospital 3 times in a year, you'd have a $1,340 deductible each time. And then you would also be responsible for 20% of the charges of an unlimited number, no stop limit, okay? Part B is your doctor services. There's a premium for Part B. It currently in 2018, the base rate is $134 a month. The government sets that rate every year. It also covers 80% of your doctor's services and includes an annual deductible of $183. You pay that $183 once a year at the doctor. If it takes 2 doctors to reach that $183, you're done after that $183. You can go to as many doctors as you want. You don't pay every doctor $183. It's an aggregate $183 once a year. Resets every January. There can be a premium adjustment for Part B based on your income for individuals or married filing jointly. So you do need to review that when you sit down and look at that and make sure you and your spouse's income doesn't see a premium increase there, just so you're budgeting. Again, beneficiaries include those turning 65 or those that have been on disability for 24 months. There are some exceptions like ALS and renal disease. Original Medicare does not cover prescriptions, dental, or vision coverage. Original Medicare, okay? So you can get a free eye exam. You tell your eye physician that they're checking for glaucoma, but that's really the only benefit that Medicare will cover when it comes to prescriptions, dental, or vision, okay? So original Medicare, okay, covers the first 80%. How do we cover the balance of that? How do we cover that 20%, limit that exposure of that unlimited number? Well, that's where a Medicare supplement or a Medigap coverage comes into place, okay? Supplemental and Medigap is the same thing. That confuses a lot of people too, okay? It's the same product. Basically, that product, you're going to pay a monthly premium, and it's going to pick up that 20% depending on what plan you get. It's going to pay the Part A deductible. All of them are going to pay the Part A deductible. Most of them are going to pay the Part B deductible. And they're not going to have they're going to be no network, nationwide, go anywhere you want. Never get another claim again, okay? So that means Medicare would cover your first 80% at the hospital, and the supplement would pick up the balance, the 20%, and pay that deductible, okay? We pay a monthly premium for that, and really what's great about those plans is the no network, no referral, go anywhere you want. Okay, that's really what you're paying for in that premium, is that peace of mind that you've got a fixed cost monthly the rest of your life. And I can tell you right now that if you're paying the base rate on Part B, you add supplemental coverage, and we've got to add prescription coverage, which we're going to talk about here in a sec, you're looking at about $300 a month premium, all in, to have 100% health coverage, okay? If the government changes the plans and the benefits, you're grandfathered in. As long as you pay that monthly premium, you'll have those benefits. Those are lifetime benefits. Okay? Now, one of the other Medicare parts is Part D. Okay? Part D is prescription drug coverage. Medicare does not cover prescriptions. This is where most mistakes are made. So you have to have a Part D plan. You don't have to have a supplement. You could have that exposure there, that 20%. But you have to have a Part D plan. Even if you're on no medications, you need to have a Part B plan, or you're going to be exposed to that same penalty that Phyllis mentioned, okay? There's 23 Medicare prescription drug plans today. 3 or 4 years ago, there was probably 45. The carriers keep consolidating. They're underwritten by private carriers, but the plans are set up and administered by the government, the regulations and the coverage limits and all that. But they're underwritten by private carriers, and there's no best plan. This is real important. There's no best plan. It depends on your prescription list, okay? So when somebody says, your friend says, oh, you need to get this plan, it's the best one. Well, their medications better be identical to yours, okay? So, and we'll help you through that process. So they're relatively inexpensive monthly premiums, anywhere from $15 to $40 a month. And then you'll have set co-pays at the pharmacy for your prescriptions, very similar to your group coverage. Your drug cost, you're not going to see a big change from what you've been paying in group coverage to when you move to Medicare. If anything, you might save a little on certain generics, but all in all, it's a pretty lateral move off of your group plan. Okay. You can just have Part A and to have a drug plan. You don't have to have Part B. Okay. But if you don't have Part B, you don't have doctor coverage, and if you don't have any other kind of credible coverage, you're going to be exposed to that penalty. Okay. So there are some circumstances where people just have Part A and they do get just a drug plan, and they have some other kind of union coverage, railroad, veterans, VA coverage. There's some exceptions there. So it doesn't apply to many people. Yes, sir.
I'm sorry, I'm full of questions.
No, it's okay. It's what we're here for.
I got Part A only right now. When I do decide to retire, I can pick up Plan B.
Yes, sir. Yes, sir. So when you come off the group, okay, when you decide to fully retire and come off the group, you'll want to pick Part B. You'll want to enroll in
I'm
Part.
not penalized.
You won't be, because you've been on what's called credible coverage. You've been on group coverage. So you're just really delaying your start into Part B. And as long as you do it in that special enrollment period window, you will not be penalized. We can get all this insurance we're talking about, the drug plan, everything will be available to you, just like it would be if you were turning 65.
You only enroll one time, or is it an annual thing?
No, you only enroll in, once you enroll in Medicare and in a supplement, one time, that most people that on the supplement side, that's usually the first and only time they'll have that plan the rest of their life. But
So when I do decide to retire, I will need to enroll
absolutely,
Part B.
absolutely. And then every year now you can review your Part D drug plan. Okay, it's important because your prescriptions can change, the formulary on the plan you have can change. You really don't ever have to do anything with Medicare or your Medicare supplement. Okay. But you do need to review that drug plan every year during the annual enrollment period, which is October 15th to December 7th. Okay, and it has to be done during that annual enrollment period. There is no wiggle room there. And once you're in a plan, a drug plan, a Part D drug plan, you're going to be in it till the next annual enrollment period. I mean, there's some special rules for disenrollment and things like that, but as a general rule, you need to make that decision during that annual enrollment period each year.
Thank you.
Yep. Now, one of the other parts of Medicare, so we know we've got to have A and B. We know we're going to have Part D. And then to get that 20% covered, we need a supplement. But there is another kind of insurance that you can get in place of a supplement. You don't do both. You do one or the other. You either do a supplement plan or a Medigap plan to cover that 20%. Or you can do what's called a Medicare Advantage plan, also a Part C plan. So these plans are lower premium plans. They're subsidized by the government. You still have to have Medicare Part A and Part B to have this plan. So no matter what you do, there's no way getting around Part B. You're going to have Part B and pay that premium, okay? But what these plans do, they're lower premium. Some of them are zero, okay? It depends on what county you live in, what plan is available to you, okay? But these plans are going to have, here's the big kicker, they're going to have doctor networks. You got to use their doctors. You're going to have to use their hospitals. Whereas on a supplement, you can go anywhere you want, anytime, no referral. They're going to have co-pays for services. So primary care visit's going to have a set copay, a specialist's going to have a copay, an MRI, outpatient surgery, a hospital stay, whatever it is. But it will have a stop limit of $6,700, okay? And it will pay those deductibles of Part A and Part B. It'll pay that $1,340 deductible every time you go in the hospital. It'll pay that $183 once a year at the doctor. Then it gives you set copays for the rest of the year with a stop limit of $6,700. The other nice thing is sometimes they include drug coverage, so you can save a few bucks not having to get a drug plan, and they can include dental and vision benefits, okay, which can be nice, but most of them, the dental and vision benefits do not there's not enough there to make that a deciding factor for you. It's really more about the network of the hospital and doctors, and because that's very important. There's some really cheap plans here that offer dental vision benefits in Pulaski County, but there's one hospital you can go to, you know. Well, are you comfortable with that? You know, most people aren't, you know. So, but that's unique to everyone's situation, and I think the best thing to do is do that assessment, see what a supplement is going to do for you, how that's going to fit your budget, see what a Part C plan would do. Do your doctors fit in the network? Does it cover your prescriptions? What's my out-of-pocket cost for services? I'm pretty healthy, I'm not healthy. All those things factor in. But the thing that's really important to remember is this guaranteed issue period. That's your opportunity to get that supplement with no health questions asked, okay? The day we sign up, you're in. The first day your Medicare starts. I don't care how sick you are, okay? They have to take you. But after that period, you've got to answer health questions, and if there's any sickness or drugs, if you're diabetic, if you're on a blood thinner, I mean, I could go on and on. You're going to get denied by those carriers. And then the only thing available to you is this Part C plan. And then we also can evaluate these Part C plans every year during the annual enrollment period. There's no underwriting on those. So we can change that plan every year. I had a lot of people that were with this carrier last year. New plan came to Pulaski County. Cheaper, better, included better dental vision benefits. We moved them from that to that, but it had to be between October 15th and December 7th, okay? So just remember, you know, those dates are always going to be very important to you. You just need to really check your options every year. Even if you think you don't need to do something, there's probably something you don't know what you don't know, you know, because there's new product and new things coming out every year. So, but it's easy to, you can always start in a Medicare supplement and go down to the cheaper Medicare Advantage plan. But it's harder to go up from the Medicare Advantage plan to the supplement. Just remember, if I start in this plan, I'm going to have to answer health questions if I want to get a supplement. Well, most people that call say, well, I'm not healthy, I've got some issues, I want to get a supplement. Well, you're probably going to get denied. You can't wait till you're not healthy. So I just want you to understand how that works, because that's where we see all the mistakes. Well, somebody sold me this Medicare Advantage plan, and I really needed a supplement, and you know, I'm sick and I need to get this, and well, it's 10 months, we're outside the window, we got to go to underwriting. They can't get it, and they're in that plan the rest of their life. And you know, it can be really big for some people. So just want you to, you know, understand that. But these plans are good, okay? I'm not saying they're not, and they serve a purpose. But, you know, what we try to do is educate you on what your options are and let you make it a personal decision, because everybody's situation is different. Yes, sir, I think we have a question back there.
So it's best to basically start at a C. Like you say, you can go down easier than climb
It's best to start in a supplement,
supplement.
because we can go down. So say you started in a supplement and you turn 65 in March, okay? Or say February next year you turn 65, we started in a supplement. And then we get to the end of the year, budget's tight, I'm pretty healthy, I want to look at something else. During that annual enrollment period, we can go down to the C, okay? We can go down to the Medicare Advantage plan, the
Or
Part C.
supplement and
Yeah, we
Part
could
C,
go
I
back
thought
to
you were
this
saying.
cheaper plan, because these plans in Pulaski County right now, they're $0 to $45 a month, okay? So, they're $0 to $45 a month. So that's the question you gotta ask yourself, you know, is, look, you know, for us, for Medicare, Part A and Part B, a supplement and drug coverage, you're looking at about $300 a month right now on average. We can save you about $100, $120 a month by putting you in a Medicare Part C plan. We can get that down to about $160, $170 a month. So what are you giving up for that $1,200, $1,300 a year in premium? No network, nationwide, go anywhere you want. Pay 100% of your claims. No out of pocket, okay? If you save that $120 a month, go do a Part C plan, you're going to pay when you go to the primary care doc, you're going to pay when you go to the specialist, you're going to pay when you get an MRI. they're affordable, you know. Most MRIs are around $280 to $320. It depends on the plan. $70 for an emergency room, $20 for a primary care visit. But if you're not healthy, that can start adding up. You know, it could be better off just to pay the monthly premium, and you know you're not going to get a bill.
So, once, if you drop down,
Yes, ma'am.
then if you try and go back up at a later date, you run into problems?
Well, you're going to have to go through medical underwriting.
Okay.
So we're going to have to fill out a medical questionnaire, and we're going to send it to about 5 or 6 carriers. And we're going to say we want Plan G. Some of them are going to say, nope, we won't give you G. You got to have Plan F. Well, it's the higher premium plan, okay? And so you're just going to get into that. Now you're on the insurance carrier's terms. And they're going to look at it. And what I'm saying is, if you're diabetic, every one of them's going to deny you. If you're on metformin, they're going to deny you. If you're on a cholesterol med, they're looking for a reason to deny you, you know. So just not saying it can't be done, you know, and but just it's hard, you know. It's 95% of the people are probably going to get denied because you're not getting younger too, you know. So as you get older, they're looking at everything. So and they're looking at prior history, you know, if you've had any kind of major heart surgery or any all that's going to deny you, you know. So they'll do a 10-year look back on cancer typically. And they're pretty good about that, you know. But really, they're looking at the prescription as hard as anything because that tells them so much. So, but don't want to scare you off of either one. There's no reason for you not to have one or the other. So say you've got your Medicare A and B, budget's tight. Hey, there's a 0 plan we can get you. It may not have all the doctors perfect, but it's at least going to pay those deductibles. It's going to give you drug coverage in case you need it. I mean, you can make something work. It's better than nothing. There's just no reason for you not to have one or the other. And and so, but just remember, if you're on group coverage, you're fine. None of these clocks start, okay? And when you come off the group, the analysts here understand. You can call me. You can reach out to them. They're used to helping people transition through this, and it's just best a few months before to do that assessment, and you be out in front of it, and it just smooths everything over for when you're ready to retire. So, any other questions? Good deal. Thank you very much for your time. I appreciate it.
All right, we want to thank everyone for spending your time with us this afternoon. We appreciate you coming out. If you have any questions, the benefit analyst, Latoya and Regina, is always available to talk to you about your pension or medical insurance or anything like that. Again, we thank you, appreciate you coming out, and have a good day.